Good afternoon. Today's Friday, September 10th, 2021, and I'm Terry Scoggin, the CEO of Titus Regional Medical Center in Mount Pleasant, Texas, and today's time for our afternoon COVID-19 update. I want to say thank you to our friends at Cypress Based Hospice and also our friends at Diamond C for being so grateful today to give snow cones on a hot September Texas afternoon to our team here at Titus Regional. Just walked past there and saw that, and I truly appreciate these two teams. Next week we'll have some pictures of people getting their snow cones and stuff, but we truly appreciate the community offering to help and offering just to thank our team members. I also want to reach out to my friends at UT Health in Pittsburgh and in the Tyler area as they're going through an upgrade of their electronic medical record this weekend. And we did that 2 years ago, and then we did it last year. So it's been something that we're familiar with, and I talked to my friend down in Pittsburgh and wish him the best luck today. So for everybody a part of UT Health, good luck to them as they upgrade to Epic, which will be a huge win for Northeast Texas, as the majority of the healthcare systems will be like us and be on Epic in Northeast Texas. It'll be a huge win for our physicians and you, the community, as well, especially during this time of COVID. I want to get into the numbers, and we talk about from a forced surge standpoint. Titus this morning is sitting at 25 patients in the hospital. We're holding several COVID patients in our emergency department and several ICU patients in our emergency department. We still continue to be at that 24, 25 number. Over the last 4 or 5 days, it's been 24, 25 consistently. When I look at the region from a regional's perspective, you can see over this last week, we went up. And, we talked to the state this morning, and was also on a call with hospitals, CEOs from the top 10 hospitals in Texas this morning as part of a board I'm on. And I got an update just from them, and they're seeing the same thing we are. We're about 2 weeks behind the rest of the state, so I was excited to possibly see some peak to this or maybe going down. But as you can see over the last 3 days, 218 in our region, 240, down to 228 there. From a Tyler perspective, you can see they've been hovering that 785 to 822, down to 805. And then in the Dallas area, we're seeing that same thing. 3481 up to 35 to 30, down to 3521 up to 36. One of the things I heard this morning that I just want to say to this, we talked with the hospitals in Dallas and the San Antonio and Austin area. They warned that some are seeing a peak, but others are just seeing a continued increase. And one of the things for the drop they're seeing is not just discharges, but mortality. And that kind of was just ripped my heart out this morning when I heard that. It's something we're experiencing here. We've seen more mortality in Northeast Texas over the last few weeks of patients who've been in the hospital 2 and 3 and 4 weeks that are passing away. So it's not discharges, it's actually the opposite. So that's one of the things when you see these numbers and see decreases in hospital beds, it's not always a positive. And that's very unfortunate. It's just rips your heart out. And it's tragic, not only to the family members involved, but also to the physicians and to the nurses and all the clinical teams who take care of these patients. So I just continue to keep everybody in your prayers. It's a tough time right now. We're still capped out. Our emergency department is as high as it's been. We're holding patients in the emergency department. If you come into the emergency department, you may wait anywhere from 30 minutes to 10 to 12 to 14 hours. With holding patients in the emergency department, it makes it very difficult to see other patients. And our doctors and our nurses and the clinical teams are just engulfed in those treatment of those severe patients that are there right now. The urgent care center that's pulling patients in the evenings is doing a great job, and I appreciate the doctors involved in that, trying to help with that. But if you come in the emergency department, not only at Titus, at any hospital in Texas right now, you're going to see this. One of my friends, CEOs, is a friend of mine, north of us, about 100 miles, 120 miles, 48 emergency rooms beds in their hospital. They have 96 emergency room patients this morning. So they're 2 for 1 almost of what they're holding in their hospital. So it's just not here. It's across Texas. We're continuing to see it. We've leveled off this week and we're staying that amount, but you're still seeing sick people. And that's one of the things I just want to encourage everybody out there. Titus has been focused on monoclonal antibodies even before the governor got it. It became cool to get the Regeneron treatment. We've been doing this with our medical staff over the last 6 to 8 weeks heavily. We did it last year, but we saw the advantage during this forced surge. You can see our numbers of Regeneron. That's outpatient. So we're giving up to 15, 16 a day. We're not an infusion center, but we're putting up numbers that are about half of what an infusion center is putting up. So I'm very proud of our staff and our medical staff and our clinical staff for being able to do this. The one thing I want to encourage you, though, and I talked to Dr. Thurman yesterday, and if you joined our town hall a few weeks ago, if you haven't, I would encourage you to go to our town hall on Facebook and take a look at it. But if you look at our town hall, Dr. Thurman talked about in a text message he sent us, one of the things we're seeing right now is people are waiting too long once they show symptoms from COVID. If you're showing any signs of COVID, a fever, and you coughing, you need to get in as quick as possible. I would encourage you, the longer you wait, and that's what we're seeing today, is people are calling to get this antibody treatment and get Regeneron, but they've already had COVID for 6, 7, 8, 9 days. Sometimes you're not eligible for it. If we can catch and get you that treatment day 1, day 2, day 3, the risk of you being severe is not near as much. And the opportunity for you to have a lighter version of COVID is encouraging. So Dr. Thurman asked me if I'd beg. They don't have one. We have the Family Care Center on the south side of town. The first floor is seeing patients. It's a same-day appointments. Just call to try and get in up there. Worst case scenario, you come in the emergency department. But if you're seeing symptoms, we encourage you to get to your primary care physician and try and get treatment from there. One of the things that would also like to encourage you is if you're showing those symptoms, go to our website. Under Titus Regional, there's a COVID resource page. One of the resources out there, it talks about provider search across the state of Texas. It talks about the infusion centers, hospitals that are treating patients, and that. It's a great resource out there if you're not within and Titus can up there, but I like that you've seen that the state does that. There's been some things from the White House over the last 24 to 48 hours that are starting to come out. There is no instructions yet on the booster shot. I know the FDA is scheduled to look at this next Friday, and they'll be giving their direction to the CDC and across to all of us next week. So we look forward to hearing that. White House is encouraging that third shot and trying to put some deadlines in there for that. But we have not seen that yet from the FDA or the CDC. We're waiting for that. As soon as we have that information, Titus will look closely to that and try and get that information out. And I see my wife is watching. She's in San Antonio with her dad. So I am bacheloring it this weekend. But it's good to see that she's gotten a heart back to you, babe. I love you. One of the last things I just want to talk about, since Angela put it up there and said hi, we are doing the vaccine clinic, and it is at the Wellness Center. Our vaccine rates continue to increase. Truly appreciate this community and the support we're giving towards that. I would encourage you to go to the Medical Plaza or the Wellness Center off Mulberry. It's on the west side of the hospital, 7:30 to 1:30 every day, 7:30 to 7 on Tuesday evenings. We go late on those days, but both Moderna and Pfizer are being given. Pfizer for the younger children, Moderna for the anybody 18 years and older. But please go online. You can make an appointment so they know you're coming, or just walk right in if you have to. And if they have extra that day, they'll get you taken care of and get you. But I would encourage you to get your vaccine. From a testing standpoint, I want to thank All American Testing. They're still giving testing on a daily basis, Monday through Friday. They're off today. They had change of plans today, so there's nobody giving testing on the south side of the hospital. So if you came there today, I'd encourage you to go back and take a look at that. Monday through Fridays when they're normally there. You can go internal computers at that time because they didn't have information inside those airports at these businesses. And I just remember how scary it was, not only for the people there, but everybody across the nation and in my family. And I remember Angela calling me, how are we going to explain this to our 7, 5, and 3-year-old at that time, and what are the discussions as a family we're going to have. So I just want to say our prayers go out to everyone, and tomorrow as we remember 9/11 and celebrate the people who gave of their lives for defense of this country. On the behalf of Titus Regional, I want to thank you, this community, for your support. Please vaccinate. Please wear your mask. Please social distance in every opportunity you can get. God bless.